else do we frequently see pain with the low back problems or the lumbar erectors? Like, where do some
hmm
of those trigger points like to go? Where do some of the nerve roots like to
hmm
radiate pain?
Yeah, and in the glutes, for example,
Hmm.
especially the part of the glute that wraps around to the front of the leg. See that. So, and then kind of where everything attaches. Um, yeah, I guess at like in the pelvis where you have that the iliac crest, you have those attachment points there. So it's kind of think of it as like if you're looking at the back and you think of kind of like a crest shape of the hip
Hmm. Yes.
bones like around there. So yeah, I mean, I guess kind of like lower down, and then if you have uh, uh, re- restrictions in the abdominals, something there could be pulling on the low back
Yeah.
as well. You could have, I mean, you're talking about some nerve impingement, I think.
Yeah.
So in um, in the sciatic nerve that
Yep.
can shoot
Hmm.
all the way up and all the way down.
Yeah.
So,
More frequently down
hmm
though, right? Yeah, we're thinking,
hmm
you're tracing out the pathway
hmm
perfectly, right? So if it's like the nerve that's pinched,
hmm
or chemically irritated, or just
hmm
space narrowing. Pinched
hmm
nerve is kind of like a blanket term that just
hmm
generally covers some sort of perturbation that lives on
hmm
the lumbar nerve roots that comprise and make
hmm
up the sciatic nerve.
hmm
But yeah, usually it's going to go into the butt. Then as
hmm
it gets worse, it's going to make its way down to the knee.
hmm
More frequently, it's going down the back of the leg, but it can
hmm
go down the side, occasionally down the front.
hmm
But usually, if pain is actually going more in the front of the hip, that's usually an indication that it's either like a higher lumbar segment or we
hmm
start thinking that it might be the hip.
hmm
And then things start to really be, dicey if we're getting pain in the calf and pain all the way down to the foot.
hmm
They can respond to what we do, but that's when we usually have to keep a little bit more in the back of our mind that it could be a trickier prognosis, and that
hmm
might be the patient that needs to
hmm
possibly have co-management of treatment,
hmm
i.e., like, okay, we're going to keep working with you with the exercises, the
hmm
muscle work, the adjustments, but you
hmm
might really need to have a good conversation with your doctor about seeing if they can get you like a steroid to calm down the inflammatory, like a muscle relaxer to
hmm
cut some of the extra tension.
Yeah.
So that way, the stuff we can do in here can actually get a
hmm
better foothold.
Yeah.
Um,
Yeah. And without
yeah.
those complementary therapies, meaning muscle relaxer, etc., it can make um, the body work in in talking more intense,
Yeah,
I guess.
most
Without
definitely.
those, it's still definitely possible. It's just it's going to be a little more intense.
Yeah.
Getting alleviating some of
Hmm.
that congestion around the impingement,
Yeah. Yeah.
whatever it may be. So
Right. Right. But to go back to just the very basic though of where it's pretty straightforward. We're
hmm
probably looking at the box from basically the top of the butt here to
hmm
about the bottom of the ribs. And that's where Ben
hmm
and I are saying that's
yeah
probably going to be about 80% of a pain presentation in people, but it could
hmm
certainly travel up, predominantly down, but sometimes the
hmm
pain does travel up as well too.